Asthma is one of the most common chronic respiratory diseases in the world, yet millions of people still underestimate its seriousness. Today, let's talk about what asthma really is, how it affects your body, what triggers it, and how you can manage it naturally and medically before it becomes life-threatening. Asthma is a condition in which the airways are the tubes that carry air in and out of your lungs. They become inflamed, narrow, and filled with mucus. This makes breathing difficult. During an asthma attack, these airways tighten even more, leading to symptoms like wheezing, coughing, shortness of breath, and a feeling of tightness in the chest. For some people, these symptoms are mild and occasional, but for others, asthma can interfere with daily life and even become dangerous if not treated properly. It's not just a simple cough, it's a chronic condition that requires regular care and awareness. Now, what actually causes asthma? The truth is, there's no single cause. It's a mix of genetics and environment. If someone in your family has asthma, allergies, or eczema, you're more likely to have it too. But environmental factors are powerful. Things like air pollution, smoke, dust, pollen, strong perfumes, or even cold air can trigger attacks. In children, asthma often starts after frequent respiratory infections, especially if they already have allergies. In adults, it can appear after long-term exposure to irritants like chemical fumes, dust, or cigarette smoke. To understand what happens inside your body, imagine your airways as soft, flexible tubes. Normally, air passes through easily, but in asthma, the lining of these tubes becomes swollen, produces mucus, and the muscles tighten around them. The passage becomes narrow, and air struggles to move. That's why you hear wheezing or feel short of breath. Asthma attacks can happen suddenly. 1 minute you're fine, the next you're gasping for air. That's why every person with asthma must always stay alert and avoid known triggers. Let's talk about common triggers. Dust, smoke, pollen, mold, cold weather, and even emotional stress are big ones. Strong perfumes, household cleaners, and pet hair can also worsen symptoms. Outdoor pollution, car fumes, and factory smoke make it worse. Even laughter or exercise can trigger breathing problems in some people. The warning signs of asthma include frequent coughing, especially at night or early morning, wheezing, shortness of breath, tightness in the chest, and fatigue after small physical activity. If you ever feel like you can't catch your breath, or your inhaler doesn't help, that's a medical emergency. Diagnosis is usually made through a detailed history and lung function test called spirometry. This test measures how much air you can breathe out and how quickly. Sometimes, allergy tests or chest x-rays are also needed to find the cause. Treatment of asthma focuses on two things: controlling inflammation and relieving symptoms. There are two main types of inhalers: controller inhalers and reliever inhalers. Controller inhalers are used daily to prevent inflammation and reduce attacks. Reliever inhalers are used when symptoms appear. They relax the airway muscles and make breathing easier. A big mistake people make is relying only on reliever inhalers and ignoring the controller ones. That makes the lungs weaker over time. Asthma should be managed every day, not just during attacks. In homeopathic and natural care, treatment aims to strengthen the lungs, reduce hypersensitivity, and improve overall immunity. Remedies like Arsenicum album, Ipecacuanha, Antimonium tartaricum, and Blada orientalis are used based on the person's specific symptoms and triggers. But always consult a professional homeopath before taking any medicine. Lifestyle management plays a vital role too. Keep your home dust-free, wash bed sheets weekly in hot water, and use an air purifier if possible. Avoid strong scents, cold drinks, and smoking areas. During pollen season, keep windows closed and wear a mask when going outside. If you're overweight, losing some weight helps improve breathing. Regular breathing exercises such as pranayama can strengthen your lungs naturally. Warm fluids like herbal teas and soups soothe the airways and reduce coughing. Stress can silently trigger asthma attacks too. Practicing relaxation techniques, yoga, or simply spending quiet time every day helps keep your breathing stable. Remember, asthma is not something to be ashamed of or hidden. With the right treatment and precautions, you can live a normal, active life. Work, travel, exercise, and enjoy every day without fear. Many myths exist about asthma. Inhalers are not addictive. Using them doesn't make you weak, it actually prevents attacks and keeps your lungs healthy. Delaying treatment or skipping doses only worsens the condition. Early management always gives the best results. Parents should pay attention if their child shows signs of asthma. Don't stop them from playing, just ensure they use their inhaler properly and avoid triggers. With good care, kids can lead perfectly healthy lives. Older adults with asthma may have additional lung issues like chronic bronchitis or cough, so regular checkups are very important. Asthma doesn't have a permanent cure, but it can be controlled so well that you barely feel it exists. The key is consistency, a regular medication, trigger control, and healthy habits. If you ever face sudden shortness of breath, lips turning blue, or chest pain that doesn't go away, seek medical help immediately. In the end, asthma management is about balance, avoiding what harms you and embracing what heals you. Whether through medical or natural treatment, the goal is to breathe freely and live confidently. Take care of your lungs, because every breath is life itself. This is Health Diagnosis, bringing you awareness and guidance for a better, healthier future. If you found this video helpful, don't forget to like, share, and subscribe to Health Diagnosis for more informative content on health and wellness. Stay safe, stay aware, and keep breathing easy.